my name is Tracy. I'm an assistant nurse manager in Peri-Up and here at MMC Surgical Services. I'm going to be giving you a tour today. Come on in. So as you enter the entryway here, you'll be greeted by one of our staff members, and they are going to help you get to where you need to go. This is one of our lobbies here that patients and their families can wait, and we have a beautiful painted mural. You can come through the elevator or enter through our staircase. Coming off the elevator, you'll be greeted by some registration staff, and you'll be able to register here. And they will escort you to our lobby, which has a lot of natural lighting and nice private seating area. We have 2 private consult rooms that you may meet with the physician. Nurse will come out to greet you in the lobby through these doors and bring you back to our patient care area. And as you can see, a patient room here. We have nice, beautiful sliding glass doors. Our rooms are very spacious. We have 18 patient rooms here, and we have 2 nurses stations that are located along this hallway. It's a very open concept. Most of our patient rooms have a lot of natural lighting, nice warm colors, very inviting and welcoming. And this is my colleague Tammy, and she's going to help me with the tour today.
Hi, my name's Tammy. I am assistant manager of the OR and endoscopy, and I'll be joining Tracy. All right, so now we'll continue our tour onto the operating room. So this is one of our larger operating rooms. It is set up to do robot surgeries. All of our equipment is now on booms, so it'll take up less room in the ORs, which is really exciting and great. So we have 2 monitors in each room that are going to be on a boom. We have our lights.
Hi, my name is Lori. I'm the sterile processing supervisor here at Memorial Medical Center, and we are so excited to be part of the new MMC Surgical Services here in Ashland. We are responsible for making sure that all the surgical instruments and equipment are cleaned, decontaminated, and ready for surgery. As the surgical procedure is completed up in the surgical suites, it comes down this soiled elevator into our area. From there, it comes into the decontamination area where instrumentation is thoroughly inspected, it's manually cleaned. From here, it'll go on to our mechanical washers. Now that we've manually cleaned instruments, inspected them thoroughly, put them through the mechanical washers, we'll go into the preparation and assembly area where we will prepare them for sterilization. Every day before surgery, staff will have a list of the procedures that will be done the next day. Staff will collect all the instruments, put them on case carts, and the case carts will go up this way to the surgical suites on this elevator. Thanks for taking a tour of the new sterile processing department. We are so excited for this new space.
Welcome to our recovery room. We have 4 open bays in our recovery room, and we have 2 private rooms.
Once you're done in recovery, we will head out the doors and back to the room that you started out in. So that's what we're going to do now. Come along with us.
Thank you for taking a tour with us today in our new surgical services area.
We look forward to taking care of you right here in the place we love.